Yo, hey guys, it's Pop and Jacques Slade here. Back with another unboxing, and today I have a guest. As you can see, this is Dr. Jeff, and he's an actual doctor, not just like Dr. J from basketball. He's like real life Dr. J. Went to school for like 1,000 years. I went to school for 3. Anyway, point is, I know you guys usually see a lot of sneakers here on this channel, but what I wanted to do today was focus on mask and some of the things around coronavirus. I tapped into some of my friends, and you'll see a little bit of that later. But first, I want to just talk about some of the things that happen with mask and almost do an unboxing of the different types of masks that you can get or that you can wear during this time. So let's start with the first one, which is, let's just start with, actually we should probably wear a mask. Maybe we should put on a mask just to start things out here. All right.
Pull it down, and then you want to pinch the nose up here.
Pinch the nose.
Pinch the nose so that basically you're preventing all the air from getting in there.
Getting in there. Okay.
Got it?
All right. So let's start with this mask that we both have on, and this is the surgical mask. Now, let's talk about like what's special about this one. Why should people wear this one?
So this is a surgical mask. This is meant for basically people in the healthcare industry, healthcare workers, nurses, doctors to wear in the hospital. In other countries, you may see like in Asia, almost everyone is wearing this mask. This is a really good mask both to protect yourself from getting virus coming in, and also if someone is sick themselves, it protects you from their sneezing and letting out all this stuff. In the US, we are such a shortage of masks that the government, instead of telling everyone to wear this mask, is really saving it for healthcare workers at this time. But I wouldn't be surprised once we get enough masks in this country that at some point in the next month or so, all of you guys will be wearing this. But this is like, I'm walking through the hall of the hospital, I'm walking through the hall of the ER. This just gives you a general protection.
Okay, and now you were telling me there's a specific way that you should actually take these off as well.
Yeah. Keep in mind, if you're walking through the grocery store and you're wearing this mask and you're trying to protect yourself, people are sneezing and you walk by. So let's say you sneeze and you weren't wearing a mask, and then I walk by, there may be some particles of virus in the air still. So these are landing on your mask and protecting you because you're not breathing them in.
Right.
The problem is when you get back to your car, you can't just go, okay, and take the mask off, because then you now have virus on your hand. So what's important is you want to pull from the ear straps back here.
So kind of like this?
Yep. And just pull it off, remembering that outside part, the dark blue, is where there's virus.
The virus is.
So you want to throw it straight in a trash can without touching that blue side. And anytime we do anything, the really important thing to remember is wash your hands again. So if I take my mask off, even if I don't think I touched the outside, I'm not sure. So I put the mask down and immediately wash my hands again.
Got it. That's good to know. Okay, so now let's upgrade. This is the one I got from Home Depot, and it says N95, and it has like, I don't know, some kind of face covering thing on the inside. But this is the one that you brought. What's the difference between these two?
So the actual normal American US N95 mask, I don't have a sample of. You know why? Because I don't have any left. We're completely out.
Right.
We managed to order some in from China, and this is a Chinese N95 mask. The difference between this mask and the surgical mask is protects against smaller and smaller droplet particles.
Right.
On this mask, there's a tiny possibility it could go through. The N95 mask, basically, it stops more particles from going in.
Okay.
These these N95 masks are what workers wear. I think the medical ones may seal a little bit better up in terms of really, because it's supposed to seal both in the nose and down here, where literally nothing can get in.
Right.
And so I don't know if potentially the worker masks don't seal quite as well.
Doesn't seal as well.
Right. So normally we reserve the N95s for basically the highest infectious things, tuberculosis, in this case COVID. Sometimes when people have a terrible flu and they're coughing a lot, we'll wear an N95, but for the most part, for any other virus, we're wearing a surgical mask. Right. These are really reserved for a physician or a nurse or a respiratory therapist who's in a room with an active coronavirus patient.
So I saw this online.
Yep.
And so I saw a woman, she used a handkerchief, she folded it up. So is this useful at all?
I love that people are coming up with ways to try to protect themselves. I've even seen people putting like coffee filters inside of
Coffee
that.
filters, vacuum filters, all kind of stuff.
Yeah. I think the idea for all of us is that if we're in public, we want to be protecting ourselves and protecting everyone else. So there are, up to 20 or 25% of people who are asymptomatic. They have no symptoms, yet they're carrying the virus.
Right.
And so to keep in mind that all of us may have it and just may not be showing signs. So by wearing a mask, number one, if you happen to start having symptoms, sneezing, whatever, you're preventing a huge cloud of all this virus coming out into the world. So the point of the mask is both to prevent some amount of droplets from going out and also prevent droplets from coming in. So obviously this is not going to be as protective as this, and this is not going to be as protective as the N95, but it's probably better than nothing. But again, even if you're doing something like this, really important, when you take this thing off, if you're in a supermarket, you've now collected virus on the outside. So you can't just take it off. You can't just put it down on your passenger seat and pick it back up. You can't take it off and touch your cell phone. You have to remember, no matter what you touch, assume it's covered and you got to wash it. If someone is ahead of you on a trail 20 seconds ahead and they start coughing and they're still running, by the time you get there, you may not even see them. You may not even know someone was there.
So, do you have time for a couple of questions?
Yeah,
so I reached out to some of my friends that, and they wanted to ask you some questions. I told them I was going to have a doctor in the house, and so they had a couple of questions for you as well.
My question is, who should be wearing these masks and when?
I think for now, what we're saying is medical workers should be wearing these surgical masks. People who are in a room with a known coronavirus patient should be wearing the N95 mask. And everyone else should be, for now, wearing these improvised masks. The reason in the US not everyone is wearing this, just to be very clear again, is because we don't have the supply. So now we're reserving these for doctors, nurses, even the janitors that clean up the hospital. All these people that are exposed to the virus need these. We need them. Or else, once the doctors and nurses get sick, this whole thing is a mess.
My question is, are there any instances where wearing a mask could actually cause more harm than good?
So I think those same two examples, basically one thing that could be harmful is if everyone starts wearing these masks, there's not enough for the medical workers. So that's one thing. But just the idea of if you don't know how to take it off properly or store it properly, if you wear a mask in a supermarket and then you put it down in your shopping bag later, you've now contaminated your own food and stuff like that. So you really got to be careful how you're taking things off and understanding that this is temporarily protecting you. But if you put it down on something like next to your cell phone, you've now put probably virus onto your cell phone. So that's a way that it could harm you.
Hey, what's going on, guys? It's Dad here. No one will completely stay inside. And there literally are people that go to a particular job every single day. The people at the grocery store, the people at the hospital, the essential places per se that everybody that's in the shelter in place act still have to go to. Does that mean that it's more people who can survive than people that can't?
And so obviously staying at home is the best way to protect yourself, especially doing these things, washing our hands, being careful in the grocery store, wearing the mask, all these things protect ourselves. The problem is, in order to get food on people's tables, people have to do something. There has to be some people out there. What we're really trying to do to keep in mind is, right now, there's no cure, there's no vaccine. What we're trying to do is lower the number of infections that are happening at one time. And what we're doing by having only some people work is some people are getting sick. We're seeing the numbers go up. But we're trying to keep that from rising too fast so that the doctors, nurses, hospitals can handle the volume of patient.
Got it.
Because if everyone all got sick at one time, half the people that were sick, there would be no bed in the hospital, there would be no oxygen tank for them. So what we're trying to do is lower the how many are sick all at once. And until a vaccine comes, essentially we're all going to have to be still indoors and just understand that the cases are going to continue to spread over time. And actually over a longer period of the more we prevent people from getting it, the longer this lasts that we're all going to be staying indoors.
What's going on, guys? It's your average consumer. Now, my question is, I've been hearing a lot of different reports, conflicting reports. I've heard that if you walk within the vicinity that someone has walked in that has it, 2 to 3 hours later, you have a chance of getting it. Heard that that's also not the case. Heard that if someone talks to you, you could possibly get it if you're not 6 feet away. So I want to know what the real answer is. Is this thing airborne? Should we be scared of locations that don't actually have people in them?
It's a great question. So this is kind of what we've been talking about. When someone sneezes or coughs, virus and those particles get released into the air. And so sometimes if you're walking, even on a hiking trail, down your own street, or especially in closer quarters, like, you know, in a supermarket, on a train, there's going to be some particles in the air for some period of time.
Right.
And so that's why wearing these masks and stuff is going to protect us. As far as how long it stays in the air, it's not everywhere in the air. It's not as if in every inch of every corner of the world there's virus in the air. But for some periods of time after someone sneezes or coughs, there will be some.
Hey Jacques, it's Tamara. Thank you so much for doing this video, and big thank you to the doctor that's going to be answering our questions. So in regards to N95 masks, I actually have one and I've been using it very diligently. I know other masks are single use. How reusable are these? And if we do have to clean them, can you show us how to properly do that?
Also a great question. And also she has a lot of great shoes. It looks
Yes. She has a crazy collection.
So the N95 until coronavirus outbreak was a single-use mask. It's meant to be where they're high risk, like again, tuberculosis, where someone's coughing and producing. That's the reason for that mask. So one thing, you can even look at what she's doing. She's actually touching the mask with her hands right now. So if she was wearing that actually around someone with coronavirus, she just contaminated herself. So again, you have to be very careful. You touch the strings, you can spray them down. There's some advice if you look on the CDC's website about UV light and about some sprays where you can reuse these masks like 6 or 7 times or something. But none of this was going to be allowed without, if there wasn't a severe shortage, they would all be single use.
They would all be single use.
I would say for most people, if you have one of these, I wouldn't use it to go to the supermarket every time you go, because it's going to degrade and then stop working. You're better off probably with a surgical mask or something for each time you go. And if you ever are in an emergency where you need to go to the emergency room for something else, you need to go to the doctor for something else, you need to be around someone who may have it, a family member, that's when you want to save your...
Jacques, how you doing, my man? So my question is really simple. I've been kind of wondering how exactly the face mask protects us from COVID-19 coronavirus. Is it something that's airborne? You know, I know we see everywhere, hey, wash your hands, and so it makes sense to wear gloves. How does the mask actually protect us? That's something that I've been, curious about and wondering.
Great question. So keep in mind, even if I put my hands in a bath of the virus, it can't get in my body because I have skin. Right. And so if you touch virus and then wash your hands, you're going to be totally fine. The virus gets into your body through the mucous membranes, through your mouth, through your nose. That's the only way it's getting in. So the point of the mask is if I touch my hand and then touch my face, my nose, my mouth, I've then put it inside my body. That's how it gets in there. So number one, you can't breathe it in, like we talked about. But number two, you can't touch your own face. So if you're wearing a mask and washing your hands frequently, take off the mask the right way and then wash your hands again. It's all of those things combined that's going to keep you from getting it.
Jacques Slade, what's up, family? What's going on, Doc? Thank you for taking the time to answer my question. It's Adam Richman talking to you from the epicenter of this madness, New York City, my home in Brooklyn, New York. I know we're only supposed to ask one question, but I admit I have 3. I'll keep them brief. Number 1, we know about over 70% alcohol and hand washing, but do steam and ultraviolet kill the virus? Number 2, do pets possess the potential of passing it on to humans in terms of their fur and stuff? I'm thinking of fostering a puppy, and I'm just curious. And if so, how do you counteract that? And number 3, once and for all, if you've had it and you have gotten over it, are you still contagious?
So a couple last questions here from Adam. So number 1, does steam or UV disinfect? So there's evidence that UV light does. You have to be careful because some people are trying to sell fake stuff, but there are specific types of UV light that actually does sanitize, and hospitals do use that. to clean the rooms, but be careful, like I said. Steaming, I don't think so, but it could be. I just don't know. Second thing about pets. So a couple things on pets. Number one is there are instances where pets have been actually tested positive themselves. So they can actually get it. It's rare, but there are both dogs and cats that have tested positive for COVID. Number two is theoretically, could the virus stay on the fur of a pet if you were to buy or foster a new pet? Yeah, just like any other surface, theoretically it could be on the pet. What do you do about it? I guess wash them soap and water with a bath when you first get them with gloves, and then wash your hands before you touch your face. That would be the safest way. And then the third question, which is a super important question, is once you're over it, are you still contagious? The answer is theoretically no. Once you are totally over it, the Center for Disease Control, the CDC, says about 3 days post your last symptom, that's when you're not contagious anymore. There will be these antibody tests that come out at some point in the next few weeks that can confirm that you're not only not contagious, but that you're theoretically immune. So you not only are you not contagious and able to give it to someone else, but you actually may be immune and not able to get it again yourself. And so that's something to look out for, really important. But great questions.
Okay, so just quick recap for you guys. Again, Dr. J, he's an actual doctor, not like Dr. J, who plays really great basketball. There's
I'm not that bad.
Different. There you go. Oh, I'm sorry. Not to say that he doesn't play ball. There's a couple of different things. So the virus, which you just mentioned, can get into your body through your mouth, through your nose, but the mask helps prevent that from happening. So when you're touching your face, the point of the mask is to stop you from touching your nose and touching your mouth or breathing in the virus from somewhere. And then mask-wise, there's a couple of different options. There's the DIY, which is for like your everyday. My mask keeps slipping down. There's the DIY, which is like the everyday kind of whenever you're going to the grocery store or walking on the street. That's what that's for. Then you have like the surgical mask, which are these, which works better than the DIY solutions, but is not as good as the 95. Yeah. And then the 95 is the emergency situation. You should only use that if somebody is sick, or you're going to be in a situation where somebody is sick. This is like the better version of the DIY, I would assume.
Yeah, I mean, these work better. The problem is there's just not enough for all of us to wear them all the time. Got it. So I think as soon as there are enough for all of us to wear, we may all be wearing this all the time.
Okay. All right, so guys, if you have any questions, leave them down in the comments below, or you can hit up Dr. Jeff directly. Like, where can they find you?
I'm most active on Instagram. It's at Jeff Toll MD, JEFFTOLLMD.
And I'll be in the comment sections, and I'll probably just refer you to his Instagram because I don't want to give you advice that I don't know about. But anyway, as always, guys, we appreciate you. Make sure you like, favorite, and subscribe. Big thank you to Dr. Jeff. Thank you for coming, man. We really appreciate having you here. All right, guys. Hope this helps you out. Get my mask up here. Sorry.
Let's show them how to take it off.
Yeah, show them how to take it off. There you go. Take it off like that.
And then
place it down.
Or in the trash.
So hopefully you got some really great info out of this video. And again, if you have any questions, let us know down in the comments below. As always, I appreciate you. Make sure you like, favorite, and subscribe if you want. But really, we just want you to give you the information that you need. All right, guys. We'll see you soon. Peace.